Welcome, everyone, and thank you so much for joining this really inspiring and important conference and bringing people together from academia, from industry, and from the delivery systems to try to figure out how we can use tools that are increasingly becoming available to us to solve complex and important problems. This year's theme is the use of technology across the lifespan. As a geriatric psychiatrist, when I've been a geriatric psychiatrist for about 35 years, and now I'm a psychiatrist who's geriatric, I have an implicit bias about a critically important part of the life cycle as we focus specifically in terms of delivery needs and the ability to address critical problems. You know, for the next 20 years, 10,000 baby boomers will achieve age 65. And I assure you, given that I'm in that spectrum over the course of the next year, it's much better than the opposite, but it also has important meaning in terms of healthcare delivery overall. It also means that between 2000 and 2030, there will be an increase in the number of people with chronic illnesses by about 37%. And by 2030, about 171 million Americans will suffer from critically important complex chronic illnesses. About 4 of the 10 IOM, now NAM, exemplar chronic illnesses are behavioral in nature, including cognitive impairment, chronic pain, trauma, as well as significant and severe mental illness. And the ability that we have as a healthcare system to be able to use the extraordinary base of knowledge that's accumulated over the course of the last 200 years, but more excitingly, over the past 20 or 30 years, and be able to find new approaches to improve care and to be able to create accessibility is critical. And with a workforce that will be absolutely overwhelmed by the number of people with chronic illnesses who require intervention and people with complex illnesses, the notion of being able to use digital technologies, telemedicine, and to be able to synthesize data in a way that can enable clinicians and even non-professional providers to provide excellence in care and to translate science into truly important care is at our hands. And so I think this panel creates an opportunity to bring together both the leaders from academia, from industry, from the delivery sector, and representing large populations who are at risk to be able to really engage in an important conversation. So the first of our speakers is Keith Fargo. Keith is the Director of Scientific Programs and Outreach at the Alzheimer's Association and really works on dissemination of science, working together with organizations throughout the country to both bring data together to service the population as well as to implement scientific programs on behalf of the people with Alzheimer's disease, their families, and the population that we face ahead. I won't go into much detail with any of the bios. As Ipsit described, if you go into the app, you can kind of dig down and find the bios of all the speakers. Keith, please.